Hi everyone. Thanks for joining me today for this informational video on how the Internal Medicine Research Group, or IMeRG, can be of use to you. As a medical student, you've probably recognized that you do need to have some research experience throughout your medical school career in order to look competitive on your CV. So, what is research? Well, it can be anything from describing a phenomenon to designing a robust experiment to test a hypothesis. When we look at the levels of evidence pyramid, you can see that the base layer is really formed by descriptive studies. And these can be editorials or case reports or even prospective cohort studies. Eventually, though, this needs to be turned into an experimental design, such as randomized controlled trials, and when there has been significant evidence from experimental designs, that can eventually go on to create evidence based practice guidelines that are delivered to us through our professional societies in order to best take care of our patients. Why are you required to participate in this? Even if you choose not to be a researcher in the future, you will be required to understand the research that is being published so that you can translate it for the patient that eventually sits in front of you so that you can provide the highest level care individualized to the context of that patient. How should you start? Well, I would encourage you first to think about what interests you. Are you someone who sees themselves as a researcher and considers a future in being a clinician scientist? Are you thinking about applying to a particularly competitive specialty? If so, you may need to have a much more robust CV demonstrating your research experience than perhaps some of the others. If you don't identify as someone with a clinician scientist future, if you're not doing an MD PhD, you may still be curious about some other things. Are you someone who's curious about how processes work in healthcare? If so, you may think about quality improvement projects. Are you someone who's interested in looking at mechanism of disease? If so, you may want to think about some basic science research in a wet lab. Are you curious about socio-behavioral effects and how those affect health and well-being? Or are you someone who may be an educator and is really curious about how medical education interventions may affect the learner and perhaps ultimately the outcomes of our patients? As you think about those, come join our meeting. For the academic year 23-24, we are planning to meet on the second Wednesday of every month, virtually on Microsoft Teams, where you can connect with our group of near peers and experts, including PIs, who can help guide you. The iMerge group also maintains a spreadsheet of projects that are underway, along with the PI who is running that project. Once you come to our meeting, you will be connected to that spreadsheet. You could think about choosing a project that matches your curiosity and your needs. We will expect you to reach out to the PI yourself. And if you haven't already, I would encourage you to get your city certificate so that you can start and prepare an application to the IRB for the project that you will be working on. Or you may choose to develop your own project. If so, start thinking about what your research question is. And as it doesn't have to be a experimental design, the research question or the research thought or the curiosity may be associated with narrative medicine. It may be associated with quality improvement, as I mentioned. You may have an interesting case that you want to discuss. You may have a medical education initiative. And of course, if you're considering translational research, then you may have an experimental design that you may be thinking about. Identify a mentor that has expertise in one of those areas. Start doing a literature search, and you may want to seek assistance from a librarian through the USF Health Library or through Tampa General Hospital. They can help you identify where the gaps in research may be based around the question that you have developed. Start preparing the IRB application. Once you access the USF Bulls IRB website, you can download the template that is most appropriate to the type of research you are planning. Start filling that out. I would encourage you to make an appointment with the RISE office as early as possible. They can really help you with the design of your experiment. They are not just the statisticians who crunch the numbers afterwards, but they can help you make sure that you're designing the experiment so you get the results that you're looking for. And we can also help guide you through the iMerge process. I would then have you think about where you might consider submitting an abstract. So think about a specialty society when their conferences may be coming up. Think about the journals associated with your specialty society. And I would certainly encourage engagement with the USF Health Research Day, which usually is in the spring of every year. And finally, did you know that we have our own journal? Through the online Curious platform, our journal is called Flagship. Check it out. Once you start implementing your intervention, really think about, is it going in the way that you anticipated? If so, great. If you're noticing challenges, you may need to go back and revise the IRB. The IRB is incredibly important, even if you have a non experimental design. Sometimes your project may be exempt, but most journals and most conferences will be asking about the IRB exemption status, or the IRB approval status, depending on the type of project. So please make sure to submit everything through IRB. Once you've completed your data collection, it's again time to reach out to the RISE office so that our statisticians can help analyze the data that you have. Once you receive that data analysis, make time to review it with your PI and your mentor and really think about, did you find the answer to the question that you had asked? Were there any surprises? And really think about planning ahead for how you're going to write this up. You might be surprised by how long it can take to put a discussion together. And certainly, if you have a team working with you, how long it might take for the team to work together and come up with uh, a project that makes sense, or a write up that makes sense. And then the next steps, think about what the conclusions are from this. Were there any limitations that you identified? And are there next steps that are coming up just from this project itself that could turn into additional projects potentially? Do remember to clarify the authorship as early as possible. This can be a point of contention for people, and then especially for large teams working together. If you are planning to submit an abstract to a conference and then an abstract to turn into a manuscript, you may think about sharing the load of first author. Remember to put your PI as the last author on whatever manuscript you do prepare, or whatever abstract you do submit. I would encourage you to invite an editor or a reviewer to take a look at your content before you submit it anywhere. Make sure to give them enough time to give you a really good feedback. Again, the iMerge space is a great place to seek out reviewers, editors, and to get feedback. Remember to secure some funding. The medical school does provide some funding for those that are primary on a project. There may be some funding available through your clinical department, for example, the Department of Internal Medicine. Your PI may have some funds from a grant that they've been using for the project that you've been involved in. I would encourage you to think about the timing of the conference. Remember that your studies take primary priority. Do not mess around with the dates of your own exams and of your own courses. So do be mindful about that. And finally, update your CV once you've completed a project, submitted an abstract that's been accepted, and submitted a manuscript that's under revision, a review. And do reflect on your learnings. When you are finally on your interview trail, the interviewers will be interested in the projects that you were involved in. Even if you learned that you don't enjoy research, you will have had some learnings that are transferable to lots of other places in the clinical professional world. So really think about what you learned as a result of participating in this project. And finally, do come and join us at IMeRG. We want to help you throughout this process, and we have access to experts who can do so, and we can certainly coach you wherever you may be struggling. Please reach out with any questions, and I look forward to seeing you.